Hello and welcome. I'm Peace Mitchell and I'm co-founder of Osmompreneur, the Women's Business School and Women Changing the World Press. I'd like to pay my respects to the traditional owners of the land that I work and live on, the Mamu people of North Queensland, and I pay my respects to traditional elders, past, present and emerging, right across Australia and the Torres Strait. Today, we're celebrating the launch of Courage and Confidence, our brand new book. This book has been written by 24 incredible Australian women in business, and it shares their stories, advice, and inspiration and motivation. And all proceeds from the sale of this book goes to providing scholarships for disadvantaged and deserving women in business to attend the Women's Business School. At the Women's Business School, we have two programs. First one is Ignite, and that's an incubator program for women who are early stage or pre-launch in their business journey. And it takes them through all of the foundations of business to help them get started and get off to on the right track with their business. Our other program is Accelerate, and Accelerate is designed for more experienced and established business owners who are ready to scale up, perhaps expand internationally, move into new markets, bring out new products, or build their team and do things bigger. And both of those programs go for 6 months, and they combine group coaching, one-on-one mentoring, and a structured program. The whole program is delivered online, and it's been designed specifically for women to be very flexible and time efficient as well. Scholarships for the Women's Business School 2022 cohort are currently open. So if you've been thinking about investing in yourself, learning more, and really scaling up your business in 2022 with the support and accountability from a group of women, then I urge you to take a look. I've just posted the link in the comments to find out more about the Women's Business School and scholarships. So I'd love you to have a look and apply today. The link to buy a copy of Courage and Confidence is also in the comments. And as I said, proceeds from the sale of this book go to providing scholarships for the Women's Business School. Now, this book has been written by 24 incredible women, and I am so excited to have one of our authors with us today, Dr. Vanessa. Please join me on stage, Dr. Vanessa.
Hello, Peace. How are you? How's everybody there?
I'm really good, Dr. Vanessa, and I'm having a very productive day, and I'm so excited to be launching this book. It feels so good, and I just love it. So, Vanessa, for people who haven't met you before, I'd love you to introduce yourself. Tell us a bit about who you are and what it is that you do.
Oh, hi. I'm Vanessa. I'm a doctor from the Philippines who relocated 17 years ago here in Western Australia to do further study in radiology. And 17 years later, I'm a business owner of Women's Breast Imaging in Cottesloe, Western Australia. It's a private breast imaging center. We have a caring commitment to women here in Western Australia, and diagnosing and screening women for breast cancer and diagnosing them for breast concerns and breast diseases. I'm a mom of 2 young kids and a wife, and and I'm a co-author of actually 2 anthology books launching this week.
Incredible, incredible. So I'm really looking forward to hearing your presentation. Now, if you are watching us and joining us on the live stream, I would love you to jump in the comments and say hi, let us know where you're tuning in from. And if you have any questions for Dr. Vanessa, I'd love you to post those in the comments as well, as after the presentation, we'll have a little bit of time for a Q&A session. All right, well, I think we should get started. So let's go to the presentation now.
Hi, I would like to acknowledge the traditional owners of the land, the Whadjuk people of the Noongar Nation, and pay respect to elders, past, present, and emerging. Thank you for having me today to talk about a very important topic, and it's a very hot topic. It's most talked about,
And breast cancer is a very scary disease. So I'm here to talk about the importance of regular breast checks and early breast cancer detection. As a disclaimer, my talk and my answers during the Q&A does not constitute a consult, and any questions that I answered does not constitute a doctor-patient relationship. So for any breast-related concerns, please, I advise you to see your doctor and get checked. So my business is women's breast imaging in Cottesloe, Western Australia. It's a historical business because it's a 40-year-old business that I've taken over 7 years ago. The previous owner, original owner, was Dr. Julian Frayne, and this business is based in a heritage listed building. Julian Frayne, when he founded this business 42 years ago, I was told by one of my GP colleagues last year that he founded this business and said he was told 42 years ago that setting up the first mammogram machine in Western Australia, he was told that he will not succeed. But 42 years later, I'm here continuing his legacy. My business is a unique business model. It's a subspecialist care only center. It's a family-owned business, and it's a business model that is the only business that is what we do here is just breast imaging all day, every day, and it's a standalone business outside of the hospital, and it has a homey atmosphere. And because, as you know, when you go to a center, it feels so hospital feel, and coming into women's breast imaging, it's a different atmosphere. We try to reassure or to try to make the atmosphere homey, less daunting, relaxed, and inviting. So what do I do? Women's breast imaging is a private diagnostic boutique center. I see patients as young as in a primary school age group up to 90 years old. Once or twice a year, I see men who's got clinical breast lumps or problems, and also I also do gynae transvaginal ultrasound check. So what does it mean by a diagnostic center? It is not similar to the national screening program here in Australia, where you only do mammogram screen. Diagnostic means we don't only screen women for breast cancer, we also diagnose breast cancer. What it means by that, we do mammogram, ultrasound, and biopsy in this business. We provide personalized care. We answer clinical concerns and the reason why your doctor referred you to as specialist breast radiologist. GPs refer women to me for opinion and management, meaning asking me after their mammogram or ultrasound, what is the next step? If there's something found on the mammogram or ultrasound report, we do a one-day procedure. It's a unique service that I do. We call it a one-stop shop. This is very important. Why? Because I see women coming from remote or regional parts of Western Australia. They travel or drive 3 to 10 hours for their test. So as you know, in Australia, there's still undersupply of specialists and doctors in remote regional countries, sites. Hence, I provide optimal care for these women who are underserved in their community. I cannot do without my team. I cannot do my work without my team. My team is my asset. My team is composed of the mammographers who would do the mammogram, the sonographers who would do the breast scans, and the only time the women will see me in a mammogram room or in the ultrasound room is when I am going to consult them or do a biopsy or image guided procedure. My job also is to support and accommodate women who were screened from the national screening program or who were tested in another imaging facility and they need further testing, they need a biopsy, and they cannot wait 4 to 8 weeks for their appointment. And so that I can fit them in within a week generally. And we can perform the mammogram, ultrasound, and biopsy all in one day. Most of the majority of my time will be in front of computer, interpreting mammograms, interpreting ultrasound, and writing a report, sending it to the referring doctors. I also provide care for women who were diagnosed with breast cancer for their annual surveillance. So why I'm very passionate with educating you and talking to you today about breast imaging and why is it important? Because breast is a very complex organ. It's not a one size fit all breast, as you know. There's different shapes and sizes, and mammogram is also difficult to interpret. There's different shades of gray and white in a mammogram, and so it's this is very important because sometimes just having a mammogram may not be enough for you. Again, breast diseases or breast cancer is a very complex disease because breast cancer, the appearance of breast cancer in a mammogram can be different in one person to the other. Breast cancer can be found only in a mammogram, or can be found only on ultrasound, or can be found in both mammogram and ultrasound. And sometimes it can remain hidden in either mammogram or ultrasound. They usually present as tiny as this, or can present as big or two cancer in the same area. So why I do what I do? Because we want to detect breast cancer, diagnose breast cancer as early, as small as 5 millimeter or less than in size, before it can grow into a large size that may occupy almost all of your breast, and before it metastasizes or spread to your lymph glands or lymph nodes. And last thing we want to happen is we don't want breast cancer spreading into the other parts of your body, like the lungs, the liver, and the bowels of the brain. So again, why do we screen? Why do I do what I do? Is to save lives from breast cancer. This is an example of a chest radiograph with lung metastasis. We don't want to see this. We don't want to see brain metastasis. Example of a head CT scan. The brain, this is the tumor. This is liver metastasis and metastasis to the bone. This is an example of women in her 50s, early 50s, which presented with just a routine check referred by her doctor. Doctor indicated in the referral that there is a vague lumpiness in her left breast. This is a mammogram of her left breast. Pictures, there is the lump, in the mammogram, and she's got a more than 4 centimeter lump on her ultrasound already. This is already a large size lump, which ideally, if she had earlier scans in her late 40s, or when she started at 40 years old, we could have diagnosed a tiny cancer before it grows to a 4 centimeter size cancer. This is another example of a lady who delayed her screening test. She only went in for a scan after a referral from her doctor. She's already 50 years old from this diagnosis. This is her first mammogram, and this is what we call delayed or late stage breast cancer, where her left breast is already completely occupied by this tumor, which has shrunken her left breast compared to the right. This is the right breast, and there's already skin thickening compared to the other side, and nipple and skin retraction. This is another view of the mammogram of her left breast cancer, and this is the normal right side. And this is what it looks like, her cancer on the ultrasound. It's already almost 8 centimeters in size, almost occupying her entire right breast. So seeing these two examples of patients is so heartbreaking for me. Since I was working as a fellow about 14 years ago, I see a lot of this late stage disease, and I've realized that I do not want being in my dark room interpreting mammogram and doing biopsies is not enough already. I made a decision that I need to reach out to reach out to people, collaborate with Australian Medical Association of Western Australia, collaborate with other women industries or other corporations to educate GPs, to educate the community, so that we don't want to see late stage disease. So that's my advocacy, is breast health education of the community. So what's the good news about breast cancer disease? The 5-year breast cancer survival rate for women by stage of diagnosis is, in Australia, more people are surviving breast cancer than ever before. That thanks to advancement made through clinical trials, research, and tailored advanced treatments, preventions, and screening techniques available now. However, for some people, their breast cancer will progress to an advanced or metastatic stage, and this greatly reduces their chances of survival. So my goal today is to educate you so that we can diagnose breast cancer at an early stage 0 or 1, before it gets to stage 3 or 4. As you know, the number of people diagnosed with breast cancer is increasing. We hear a lot of, like me, I am directly and indirectly affected by breast cancer. I've got relatives and friends who were diagnosed with breast cancer. I'm sure there are a lot of people in our community who are also been diagnosed with breast cancer, or who know someone who died from breast cancer. Early detection and improved treatments has led 9 in every 10 women diagnosed with breast cancer in Western Australia surviving the disease. The number of people being diagnosed with breast cancer in Australia is increasing. However, the number of breast cancer deaths are decreasing. So this is very important and great news for us, because we are seeing a reduced number of deaths. But knowing that breast cancer exists is not enough. There's a lot of breast cancer awareness marketing on social media or in our community. There's the October Breast Cancer Awareness Month, but knowing is not enough. We need to be proactive with our health, and I'm here to empower you to be in charge of your breast health so you can change your future. So I'm sure a lot of people can relate to this. It's a lot of anxiety of having breast checks, and I'd like to clarify or educate you of the misinformation or conflicting information about breast scans and breast information. So enough with the scaremongering. Let's talk about what's the common clinical problems I see in my daily practice. I see a lot of women almost every day freaking out because they have breast pain and they think they have breast cancer. Breast pain is common. It is usually hormonal, and but if you have a symptom, please don't disregard this breast pain. Please see your doctor, get it checked, and if needed, get a mammogram or an ultrasound, or both, if depends on your age. And people hear a lot of horrible stories of having a mammogram. It's like a torture chamber. It compresses your breast to a pancake, and that is causing them anxiety having the mammograms. But and also they are also scared to have a mammogram because they have small breasts. I have small breasts, but it can be painful to have a mammogram. I agree. I can relate to that, but it's really not pain. It's actually a 7 seconds of discomfort and compression. So I don't think you need to worry about the compression of the mammogram machine, because what I always tell women, a tight mammogram is a good mammogram, because if the mammographer will not compress your breast properly, chances are there will be movement artifacts, or your mammogram scans will not be optimal, and I may need to call you back in for a repeat, which I don't think you'd like to happen. There's still a handful of women believes that compression from the mammogram can cause tumor spread. This is myth, okay? This is not true. So let's talk about radiation. There's still women who believes that radiation from a mammogram can cause breast cancer. Radiation from a mammogram is different. It's not equivalent to radiation from a radiation treatment for any type of cancer. That is different. The amount low dose radiation exposure from a mammogram is a minor concern, and it is not proven to cause harmful effects to our breast. Mammogram is a life-saving device or test that can pick up early breast cancer. The amount of radiation we get from the mammogram is equivalent to our natural 14 days of natural background radiation. And what I normally tell women is that every time they ask me about radiation from a mammogram, I tell them that our body is subjected to natural background radiation when we fly overseas or interstate than from a mammogram. So we don't need to worry about radiation from a mammogram test. So most common anxiety that I see from my daily practice is women coming in who already diagnosed themselves and checked Dr. Google and already made an effort to check who is the breast surgeon they're going to see because they thought they have breast cancer already. Please don't do that. So another important question that I encounter, I do not have any lumps and I do not need additional checks, or I don't need regular check, or I don't need a check at all. This is very important because in breast cancer, you do not need to wait for a lump to go for a check. The size of a tumor in a mammogram can be detected as small as a small bead. So that's the goal of screening. We want to find baby cancer like a tiny bead before you can feel it, before your doctor can feel it, and before it spreads to your lymph nodes or to the other parts of your body. So that's the goal of screening, and that is early breast cancer detection. So we see a lot of ads about checking your breast and looking and checking your breast in the mirror. But what I want to reiterate, for example, is that in a mammogram and ultrasound, we can diagnose a 5 millimeter or less than that of size of a breast cancer before you can even feel it. Please do not wait for a change in your breast. Don't wait for indentation before having a check, or skin redness, or any anything like this, nipple discharge or dimpling. Please don't wait for these signs. Come in early for a check before you see this. This is already advanced stage. Another most common clinical problem I see every day is people will say to me, it's a nightmare to feel my breast because it's just so lumpy. And I don't know where to feel and check. I'm glad that they do their breast check. It means that they know what their breast feels like. So that means that a lumpy breast is good, because it means that you know what is your normal lumpy bumpy areas, and anything unusual from your lumpy bumpiness or lumpy bumpy breast is a time to get checked. And it also means that you need to have regular for example, annual or every 2-year check with your doctor, because 9 out of 10 breast changes are not due to breast cancer. But please see your doctor to be sure, and don't delay and make an appointment ASAP. This is just a guide of self-breast examination. You can download this from our WVI website. So what it means by self-breast exam is doing self-breast check once a month only. Don't do your breast exam every day, because this will drive you mad. This will drive you crazy, because your breast will change every day, depends on your hormonal cycle. So know your breast, know your normal lumpy bumpy areas, check your breast, for example, first day of the month, and then anything unusual from your normal breast feel is see your doctor straight away, get it checked, and if needed, get a referral for scans. So another misconception of breast check is I'm healthy, I eat well, I exercise regularly, and I do not smoke, so I don't need a test. Would that resonate with you? If it does, please, this is what I always tell women. 75% of all breast cancer happens in women with no known risk factors or family history. So if you're due for your mammogram, due for your breast check, please get a referral or go to the national screening program for your routine check. Don't wait until it's late. So why is it important to start early? Because breast cancer, as you know, does not discriminate. You know, I'm sure you've heard stories of women being diagnosed under 50. I'm sure you've heard women diagnosed with breast cancer under 40 or sometimes in their 20s, in their 30s. So when do you need to start screening? If you're not yet 50 and you're not sure, so the most common question I get asked is, when do I start screening? I always say 40 years old because the years of life lost to breast cancer are highest for women in their 40s. Women in their 40s is a very important age group, like my age group, because these women are the ones with kids with young age group kids and being diagnosed with breast cancer in this age group at a late stage or advanced disease can reduce your lifespan. Instead of having another 40, 50 years of your life, that is reduced to maybe 30s. Another most common question, or some heartbreaking questions I encounter are women over 75 or women are diagnosed with breast cancer in their 80s and 90s because they are being told that after 75 they don't need a check. So I just reiterate to them, if you are fit and healthy, to come for a breast check. Like my friends who are also triathletes like me in their late 70s, if they're fit and healthy to get a scans, please continue calling privately or to the national screening program. They're still the service is still available, but they don't get a letter. Again, most common clinical problem or most common question I get asked is, I have a strong family history and I feel like I have a cancer, and they feel that they are taking time bombs and they feel that anytime, any year, any day, they will have breast cancer. But what I reiterate to them is approximately 5 to 10% of breast cancer are due, only 5 to 10% of breast cancer due to strong family history and genetic mutation. Again, this is rare compared to the 75% of women with no risk factor or family history. And again, I'm sure a lot of people will resonate to this. I am too busy. I do not have time for this. I do not have time to be sick. I'm also a full-time mom, a working mom, and I don't have time for breast check. But as a doctor, I advocate for preventive medicine. So I advocate having regular and timely breast check, because but breast cancer does not discriminate, and 40% of cancer cases occur in people in the working age group, which is our, I'm sure, our Osmanpreneur community. We all have the 40% risk. So we try to be superwoman. We try to be busy. Sorry, we work hard and we're so busy and productive doing a lot of things for our family, for our business, or for our work, or for everything we do. We do a lot. And it breaks my heart every time I hear this kind of story. But please, no matter how busy you are, if you find a change in your breast, or if you turn 40, please see your doctor without delay. Early detection is vital to surviving breast cancer. And be your own health advocate. So I'm just going to show what's the update for others who have been going to very good and on top of their breast health and going to the national screening program, or some people who've been going privately. Some might have heard about what's the latest in mammography. If not, I'd like to just give you a quick background. What is the advanced mammography? Advanced mammography is a 3D mammogram of breast tomosynthesis, which is developed to help eliminate detection challenges associated with the conventional mammography, which is the 2D mammogram or screening, which is a 2D mammogram still used in the screening program. It's actually a better mammogram. It's not really new. It's been used internationally as a standard practice since 2012, 2011, and I've been utilizing this technology since 2015 as for screening and diagnostic purposes. It is the standard practice now for majority of all private imaging facility in Australia. Most especially in Western Australia. I'm not sure about in the eastern states. So yeah, all women who comes in at WBI gets a 3D mammogram, and the amount of radiation from this mammogram is actually reduced in 40% radiation dose compared to the older conventional mammogram. So this is just a visual example of a mammogram, a 3D mammogram.
Which are reconstructed and almost immediately displayed on the screen. The procedure is repeated for the MLO views of both breasts. A complete exam takes about 5 minutes.
I think we missed the first part. Let's do it again.
Taking 15 low-dose projections, which are reconstructed and almost immediately displayed on the screen. The procedure is repeated for the MLO views of both breasts. A complete exam takes about 5 minutes.
Okay, sorry about that. So why is it important for me to tell you what is the advantage of having a 3D mammogram compared to the traditional or conventional mammogram? This is the next video.
Creates a three-dimensional image set. So now the doctors can see and search through your tissue in 1mm layers. Why is this a good thing? Well, a traditional 2D mammogram shows all the breast tissue at a glance. That means one feature can hide in the shadow of another. So it might look like there's a cancer when there isn't any. Or there could be a tiny cancer we just can't see. A Genius 3D mammography exam is different because it shows your tissue in very thin layers, almost like turning pages in a book. That makes it clearer for doctors to see if there's anything to be concerned about. There's less chance for a cancer to hide behind overlapping tissue. It also means there is less chance your doctor will call you back for a second look because they can see more clearly now.
Okay, so that's about the 3D mammogram. You can see the importance. There's more information. It's like a CT scan of the breast, and I will be looking at your mammogram slices, 1mm slices each breast, and it means that instead of me looking at 4 pictures of your breast in a mammogram, I'll be looking at 200, 300 pictures of your breast. For women who already had their breast ultrasound, that's great. But I just want to add this, the importance of ultrasound as adjunct or supplementary for your mammogram. So ultrasound is a supplemental imaging scan for breast cancer screening, and I use ultrasound to guide me to target the breast lumps for biopsy. And it is also supplementary exam or supplement test for women who have very dense breast tissue. What do I mean by dense breast tissue? Our breasts are comprised of fat and milk producing breast tissue. Fat is gray on the mammogram, which is like this, gray on the mammogram. This is your a sample of a mammogram. And fibrous milk producing hormone active breast tissue is white on the mammogram. Again, this is another picture of a right breast. So what it means by this is your normal breast tissue, which is the white part of your breast in the mammogram, is similar. It's also similar to a breast cancer. Breast cancer is also white on the mammogram. So imagine a cancer like this. This is a dense breast mammogram, meaning less fat, because there's less fat in the body, hence there's less fat in the breast. That's just the ratio. So of the fat and dense tissue. So it means that more than 50 or more than 75% of your breast is dense or white, hence cancer change or cancer lump like this will remain hidden, even if this grows from 2 centimeters to 5, it can remain hidden in this dense breast tissue. So it's like it will be challenging for me, or I won't be able to diagnose your breast cancer if you have dense breast, and also if you're only having a mammogram. So that's why I utilize ultrasound to check for cancers that can remain hidden in a dense breast tissue. Breast density is a whole day discussion, so I'll talk about it more in a next opportunity if I have, hopefully. So this is another example of different kinds of breast density, meaning less fat, more dense tissue ratio. So this is just an example of a large cancer hidden in this very dense breast tissue, a tiny cancer that it can remain hidden and can grow undetected in a very dense breast tissue, like this one. Again, another cancer remain hidden in a dense breast tissue. Another example of dense breast tissue. She's got a lump, and you can vaguely see the lump, but there's actually 2 lumps, 2 breast cancer in her left breast, which also already spread to her lymph nodes. And she's only 52. She's a nurse, and she did not have screening as early as 40s. So if women with breast implants also are not exempted from mammography, I think there's still a misconception that their breast implant will burst with mammogram. No, that's not correct. We do mammogram on all breast implant women, and we only compress lightly, very lightly on the breast implant, but we take extra pictures of the front part of the breast to check for any evidence of breast cancer. This is an example of a cancer that is hidden on a mammogram, which can only be seen on the ultrasound, and presumably this is where her cancer is on the mammogram, and she's only 45 when we diagnosed her with this invasive breast cancer. So to wrap up, why is it important to have regular breast checks? Because the best time to treat breast cancer is when it is still very small, tiny lump. We want to diagnose tiny lumps before you can even feel it. Remember the seeds. Breast cancer does not discriminate. So my take-home message is to empower you to be your own advocate for your health. I'd like you to have a well-informed decision and make a shared decision with your doctor for your for the appropriateness of your breast test. Early detection can improve your chance of survival. You can change your future, and by improving your chances of survival and having detected breast cancer early, the effect will be less extensive treatment and cost for you and your family. So please start your screening mammogram at 40. And ultrasound does not replace mammogram. So I've told you about breast density. So even though you have dense breasts and difficult to find cancer on the mammogram, screening mammogram is still the #1 test, first line of test before an ultrasound. Ultrasound will not replace mammogram, and it's only adjunct to your mammogram. Why do I say that? Because ultrasound can not pick up cancer changes like breast calcifications in your ultrasound, so which we can only see on your mammogram. This is just an example of a beginning cancer cells in the milk ducts before which can be only seen on your most of the time can only be seen on your mammogram, and less likely on ultrasound. So reminder, please do not only do your regular checks, please do your monthly self-breast check, but also get timely and regular mammogram and ultrasound if, for your optimal breast care health. So thank you so much for having me today for this masterclass. You can find me through our Women's Breast Imaging website, Facebook, and in my personal brand page, drvanessa.com. I'm ready for your questions.
Thank you so much, Vanessa. Really informative presentation, and yeah, lots of info in there.
I hope there's no information overload now.
I think there's plenty of information, and also I've posted the links for how to do self-checks as well, because that's really important, isn't it? Why are self-checks so important?
Because you're the only one who knows your breast. I will not know how your breast feels like. Your doctor will not know how your breast feel like. So just know the normal lumpy, bumpy areas in your breast, and any changes, see your doctor, get it checked, get a clinical breast examination, meaning when you go for your screening mammogram referral, go to your GP or your doctor for a refer for a screening mammogram ultrasound, you also need to have a clinical examination, because you cannot also rely on your self breast examination. Is that correct? So your doctor should also be doing a clinical examination so that they can map in the referral where the radiologist will concentrate on those areas of concern.
Okay. And you're recommending women should start getting breast scans from 40 years of age?
Correct. And that's the actually the national breast screening recommendation. It's on their website, but the active invitation to get a free screening mammogram is from 50, but the program is available for women from 40 onwards and over 75. They can just need to ring the national screening program.
And would you recommend monthly scans or every 5 years? Like, what's the recommendation? Like, once you're in that age?
So the current recommendation is 2 years, every 2 years from 40 onwards, and then depends on your personal, family, and other risk factors. Your doctor will recommend yearly scans.
Okay, great. Well, thank you so much, Vanessa, for presenting today. And where can people get in touch with you if they have more questions?
So more questions will be from our website, wbi.net.au, or we have our own Facebook page. You can send personal direct message there, or you can just email us from our website.
Wonderful.
The link, I think we'll send it later. Yeah.
Yes, post the link in the comments there. That would be wonderful. Well, thank you so much for your presentation, and thank you for being one of our co-authors of Courage and Confidence. I'm so proud of this book, and it's officially launched now. This is the last session in our launch festival, and yeah, I'm really excited, and congratulations to all of our incredible authors right around Australia and even internationally. One of our authors is international, for being part of this project and collaboration. If you don't have a copy of Courage and Confidence yet, you can pre-order from our website, and the link is in the comments to order your copy of Courage and Confidence, and all royalties from the sale of this book go to providing scholarships for the Women's Business School. All right, everyone, thank you so much for joining us, and we will see you all again soon. Bye, everyone.
Thanks for having me. Bye-bye.
Thanks, Vanessa.